Hi, everyone. Delighted to introduce Optimi Health, a virtual sports medicine platform. We've partnered with England Athletics and your club to deliver elite level sports medicine to the everyday athlete. My name is Shane Kitanagara. I'm the Chief Clinical Officer of Optimi Health, and I'm the current consultant physiotherapist for the Melbourne Storm. I'm also the lead physiotherapist for the Human Performance and Optimisation program at the Royal Australian Air Force, quite a mouthful. And former physiotherapist, head of medical performance, at the New South Wales Waratahs. Today, it's a great privilege to have Ben Trevor Jones with us here as well. Ben, do you want to introduce yourself?
Hi, hello all. Thank you very much for joining us. My name's Ben. I am currently the NRL rehabilitation physio at the Parramatta Eels, based in Sydney. Prior to that, I've been in the UK. Working with the Olympic sprint, kayak and canoe squads. Prior to that, I did a little bit in county cricket and football as well. So looking forward to sharing all I know about injury prevention with you.
Nice one. So today we're going to talk about prehab, and we're going to talk also about preventative sports medicine. So the outline for today we'll go through what prehab is. We'll also talk about the bigger prevention picture. Injury prevention and the big rock. So Ben will talk about what are the key take-home points with regards to injury prevention. We'll also explore general prehab versus specific prehab. So the role of screening with respects to individualizing prehab. We'll also then talk about our previous experience with preventative rehabilitation and professional sports. And then lastly, we'll get specific and down into the nitty-gritty about prehab and the running group. So what is prehab? Prehab is preventative rehabilitation. It is designed to prevent injuries. We've called it many things in sport. So we can call it correctives. We can call it injury risk reducing exercises, microdosing, bulletproofing, whatever you want to call it. They all have the same aim, which is it is designed to reduce the risk of injury or prevent injuries. Generally, they are low to moderate level exercises, focusing on control, strength, endurance, and function. So they're not too taxing. They're not big lifts. They're not big movements. They're just little movements to aid the facilitation of little muscle groups rather than the big muscle groups in order to improve function and, again, reduce the risk of injury. They can also include range of motion exercises. So prehab can be used. We can identify risk in many ways, and based on how we identify risk, we can then prescribe prehab exercises. So we can identify risk by looking at the individual, so screening. We can identify risk by looking at the individual's age or gender. And we can also identify risk based on the sport or the activity that they are performing. So by identifying, for instance, the most common injuries in a particular sport, we can then identify where the riskiest areas of the body are, and we can then tailor our prehab to that area. So, next slide. We need to look at this as a bigger picture. So I think it's really important to note that prehab is only one part of a multi-factorial approach to injury prevention. So looking at this circular chart, I'm going to work from the bottom and then around. So addressing previous injuries. There is no bigger indicator to current injury risk than previous injuries to the same area. So if you've had a previous hamstring strain, you're more likely to get a hamstring strain later on. If you've had a calf strain, you're more likely to have a calf strain. If you've had an Achilles tendinosis, you're more likely to get an Achilles tendinosis in the future. So it is very important, therefore, to rehab previous injuries very well. So we want to get symmetrical. We want to get supermaximally strong. We want to be able to address the condition, and not just to return to play or just to plod. We want to return to perform. So Optimi Health's self-managed programs and our pain programs help with this. They take you to a level not just to return to run, but all the way through to return to performance. So if you're carrying a previous injury, or you're carrying, if you're carrying a previous injury and you don't feel like it's quite up to scratch, or you're carrying a current injury, that's worth getting on. Education, so working left and around in a clockwise manner. Education, something like this, hopefully will go a long way in helping you prevent your injury. So determining where the risk factors are and what things you can do to, again, reduce that risk of injury. Strength, conditioning, and mobility. So I'm a big believer, Ben's also a big believer, that load is protective. So being stronger, being fitter means that you're actually more resilient to injury. And we know for a fact, for instance, that people who can get through an entire preseason in sport, they're less likely to get injured in season. Therefore, indicating that if you've got a better base behind you and you've got a better training load behind you, that you're actually less likely to get injured. So again, training load is protective. Preparation and recovery. So preparation, some people call it a warm-up. I think it's a whole gamut of things, basically preparing for an event, preparing for a run. And recovery is what you do after the fact, is essential for injury prevention. Recovery, the two main forms of recovery that people probably don't focus on too much, but we know is super important: sleep and nutrition. Systemic health. So if you're fitter, if you're not carrying an illness, you're less likely to get musculoskeletal injured than someone who is a little bit crook or unwell. Load management. So load management is, for want of a better term, basically how many miles for a runner that they put into themselves every week or every month, depending on how you want to quantify it. So as we said previously, load is protective. If you're consistent with your load, you're less likely to get injured. It's how we obtain a high level of load. We want to reduce the risks of injury by avoiding spikes, avoiding low periods of training, excuse me, followed by heightened levels of training. Those are the risky times for injury. If you're consistent and you periodize your training well, again, you're less likely to get injured. The Optimi app actually has a load management feature. So we basically allow you to track your load in a scientific way, ways that we've used in sport in the past and they continue to use in sport today. It is the most efficacious way to track load. So we basically look at how many minutes you've run, your rate of perceived exertion, and then from there we put it through a calculation, and then over 4 weeks we then can determine what your acute chronic work rate ratio is. So that basically means how much load you're putting through your body in the last week compared to the baseline level of running that you've done, or the baseline level of load that you've done over the last month. And there's very well proven research to show that we want to stick within a certain ratio. So get on the Optimi app and you can have a play around with the load management feature. Then we've got athletic monitoring. So athletic monitoring is internal load. So we've spoken about this in the past for those who have been in our webinars before. So external load is how much volume you're putting through your runs per week or per month, depending on how you want to track it. Athletic monitoring, or internal load, is how your body is perceiving that external load. So how it feels after it goes for a run, how it feels after you do a strength session, etc., etc. So if your internal load is high, which means that your body's really struggling to cope with the external load, then your risk of injury is higher. So we can track this in many ways. So rate of perceived exertion, or RPE, is one way we do this. Another way we do this is through wellness. So wellness can be grouped into many different subheadings: your perceived mood, your perceived level of physical and mental fatigue, your perceived level of sleep quality. So these are called wellness markers. We have these on the Optimi app. And again, you can track your internal load and your wellness markers over a period of time and assess that against how much volume you're putting through your legs. Then we get to prehab, the crux of today's webinar. So prehab, again, is are exercises designed to reduce the risk of injury, and we can get into that a little bit further. And the last one is early intervention. So early intervention is basically seeing if you can pick up a niggle, and we've all done this before. And once you pick up a niggle, we basically modify accordingly. So generally, when you ignore a niggle, it can get worse. Sometimes it comes all right, comes good. But if we can basically intervene early enough, that niggle doesn't become a catastrophic injury, and therefore we prevent injury. So the next slide, we go into the big rock. So here are the key take-home points with regards to injury prevention. I'm going to hand this back over to Ben.
Very good. Thanks for that, Shane. Yeah. So if we think about injury prevention now as the big rock, so if you're a runner and you're thinking, right, what are my take-home messages? What are the key factors that I can really try to apply to my day-to-day routine or training schedule to help try to reduce your risk of injury? So as Shane has alluded to in his previous slide around past injury history, so rehab well. It's really important that you get those previous injuries right, and that's going to ultimately reduce your risk of injury. That's probably the most powerful message we can send from this slide in particular, is that if you can try and stay on top of the injuries that you've had previously, you'll go a long way to keeping yourself running and staying as fit as possible. You've then got to consider like poor training load. That's a really important one for injury prevention. So as Shane mentioned on the previous slide as well, and it is super important, is that training load is protective. So we want people to train. We believe in it. We think that's how you're going to keep your tissues strong and healthy and able to tolerate the training you want to do. That works both ways in terms of you want to avoid those spikes in training load, but then also we want to avoid those big dips. Trying to maintain a consistency, keeping in mind that the odd deload with a stepped up increase is generally the perfect way to go about your training. Consider the Optimi training load feature that we've previously spoken about in terms of how you can try and manage those loads. It's really useful. It's something we use in sport day to day in terms of using our training loads to understand when people are ready to load a little bit more, or sometimes when we need to pull them back. And I really encourage you all to try and apply that to your training. I think you'll see some benefits. It'll have a really strong impact on your injury prevention. High internal load, so your wellness flag. So this again can be quantified. So consider this as your level of motivation, your level of perceived fatigue, your level of stress and mood. I mean, it makes perfect sense that all those things are actually going to impact how you feel during training, but then also how much energy your body's got to recover. So being able to track those internal loads helps us be able to quantify actually how well are you tolerating the training, and then how hard can you push. So as mentioned, Optimi does offer that feature and have the ability to track your wellness. I'd really encourage you to explore that option, because I think it can be something that can help you understand how your body's tolerating the training and where you can take it. The next one would be illness. So obviously illness is going to heighten your risk. Illness takes away energy that you've got for your tissues to be able to repair from your training, to be able to deliver what you need from them during training. So it's an important thing to recognize, and that's going to be a really important factor in terms of injury prevention. Then you've got early identification of injury. So that's your secondary prevention. In sport, what that looks like is often our monitoring. So we might use some typical movements like a calf stretch or a hamstring stretch to understand where our athletes may be tight. And if there is some tightness, then often we can then try and apply some strategy. So that might be using some trigger ball work or a foam roller or some additional mobility to try and free up those tissues, and then we can reassess. That's that secondary injury prevention. You're sort of dealing with those niggles as they rise and see whether we can either try and train with a little bit of extra work, or in some instances, it might require some modification to your training. So that could be something you can apply to your own training sessions, having some mobility exercises in your warm-up or some activation exercises, just to check in with how the body's feeling. Maybe it needs a little bit more mobility. Maybe it needs a small modification in your training. That's a really important method for injury prevention and actually just getting the best out of yourself during training and giving yourself the best chance. And then finally, you got that next tier of injury prevention strategies, and that's your prehab. That's those exercises we're using to try and target those at-risk areas, whether that's to do with your sport. So in this case, it would be running. So we're going to be targeting calves, hamstrings, potentially glutes, and how they impact the knees. Those are the key muscle groups. But then also the individual factor. So what's your injury history? Are there some key exercises that you need to be doing to try and stay on top of those past injuries to make sure they're not cropping up and stopping your ability to run? I think that summarised it all for us there, Shane. If you want to move to the next slide.
Yeah, thanks, mate. I'm going to go off script just quickly before I go to the next slide. But we, in the past, we've talked about the 3 colliding variables to injury. And I think that's a big rock as well. So basically, when you see injuries in sport or in running, it's generally 3 variables that result in that. So let's say someone coming back from injury, they've had low training loads as a result, and they've had a really poor night's sleep because they've got a newborn, and off they go for a run and they ping their calf. Now this story happens very much so in sport, and it's very important to note that generally there's, there could be 1 variable, but generally there's 3 or more variables involved with injury, and it's important just to read your body and to modify accordingly if you've had, for instance, a rough night's sleep, or you've been a bit crook, or you haven't run for a while, just to grade that running progression or that training progression back up again slowly. So questions around whether we need to be specific with prehab. So specificity around prehab. So we talked about the biggest big rock being previous injury. So there's no bigger indicator to current injury risk than previous injury. So the answer to being specific with respect to prehab is yes, when it comes to identifying your past injury history. After which, the next specific thing that we need to look at is the sport rather than anything else. So prehab specific to the sport is more important than being specific to the individual based on screening tests. And I'll go through a study that shows that in a second. So when we know, for instance, the most common injuries in sport, we can give the training cohort a group of exercises to target the most common areas of the body that get injured in that particular sport, rather than individually screening a whole team, which is obviously time consuming, and then coming up with these specific kind of, individual exercises based on the screening test. If we just target the sport and we give everyone the same barrage of prehab that is, again, specific to the sport as well as to the individual with respects to their previous injury, then we've covered an excellent prehab routine. So the Optimi's prevention program targets this. So we use a bunch of calculations, one of which is to ask you what your previous injury history has been, what year that occurred. It then goes on to ask your age and gender, because there are specific conditions that are more likely to occur based on your gender. So, for instance, calves and being male, and ACL injuries and being female, for instance. And with regards to age, again, middle-aged males are more common to get calf strains. And then further to that, then we ask about what sports you play, or if you're a runner, specifically what types of running you do. So is it distance, is it trail running, is it sprints, or is it running hills? And again, other sports as well. And based on that, how often you play the sport and how much risk the sport holds. So for instance, rugby being a contact sport holds more risk than, let's say, something like fencing. We will then tailor a prehab program specific to your individual needs based on your sport and your previous injury history, age and gender. So going into it in a little bit more detail, so Barr in 2016 writes a great article. It was written in the British Journal of Sports Medicine, so a big, heavy-hitting, high-impact journal. Screenings are unlikely to predict injury with sufficient accuracy, and personalised intervention programs based on screenings are no more beneficial than programs given to all athletes performing the same sport. So just identifying what we spoke about and the reasons for why we've gone down the line of allocating prehab this way for Optimi Health is based on the research, like everything that we do on the platform. So knowing common injuries to sports is crucial in determining appropriate prehab exercises. So we're going to give you a couple of examples for that. My experience is in rugby. There was a Rugby Australia research article that basically showed the 11 most common conditions in rugby. And based on that, the states, well, my state that I work for, which is New South Wales, we were able to then target the 11 most common injuries in amongst our gym program, which is already there, and 4 prehab modules. So here are some examples of the most common injuries in rugby: ankle sprains, hamstring strains, ligamentous knee injury, shoulder instability, lower back pain, neck pain, concussion, etc. So the 4 prehab modules that we end up going with were trunk strengthening, again, targets lower back. And part of that is also targeting ligamentous knee injuries, because if you have better trunk and glute control, you're less likely to injure your knee. Neck strengthening for both concussion and neck pain. A jump land program for all sorts of injuries, so ankle sprains, ligamentous knee injuries, etc., etc. And shoulder prehab for shoulder instability. The gym program itself that was run by the strength and conditioning department already covered a lot of the injuries, the most common injuries in rugby. So the gym program included eccentric hamstring strength and mobility or stretches, use of the foam roller, trigger ball, etc., etc. So we didn't have to cover that in our prehab program because it was already excellently done within the already existing gym program. Following implementation of a specific shoulder prehab program the following year, which is 2018, we had no game loss associated with shoulder injury following implementation of our shoulder program. So it does work. Doing the right exercises for the right sport and for the right individual is beneficial. My experience in the RAF. So RAF injuries, the most common RAF injuries are neck and lower back pain. So with that, we have a RAF specific neck strengthening program that we implement within our gym program. The gym program, as you said already, covers trunk strengthening and mobility, which then targets the lower back component of the most likely injuries that occur within the Air Force. And as a result of our implementation of our program since the end of 2020, we currently have no air crew on the base that I work in currently downgraded, which means injured due to physical injury, which is, looking back on historic data, never happened within the squadron that we currently work with. So I want to talk about how to optimize engagement with prehab, because sometimes if for the coaches out there, it's a hard sell. People just want to run, they want to just get going and, off they go and perform. But it is very, very important to obviously consider injury prevention strategies within your training. And so part of that is to sell that to the athlete, and part of that is to basically encourage optimal engagement. So it is our opinion to attach prehab to an already existing excellent exercise routine and a pre-existing exercise routine as the best means of optimizing engagement with respects to prehab. So in the RAAF and the Waratahs, and the Storm, we've implemented prehab exercises before gym and or training, or within the gym program. So it's hidden in amongst the performance lifts. It's hidden amongst the day, and so the player is more likely to do it. So with regards to general population and specific to running, if your prehab routine has mobility or glute or trunk exercises, it's best to perform that before running, because that, again, lowers the risk of injury it also it's more likely to increase performance because you're more stable. You probably have optimal biomechanics when you're running. Excuse me. If you perform those types of exercises before you run. However, exercises that are a little bit more taxing, like calf and hamstring strengthening, we would tend to perform after running, because we don't want to basically use up all the juice or the energy within the tissue prior to the run itself. So if you basically do multiple reps of calf raises before you run, you're probably not going to be great at running that particular day. So best to do your more taxing prehab exercises like calf and hamstring strengthening after you run. Going back to a previous point, prehab exercises are low to moderate in level. Again, not to cause too much fatigue and affect performance. So we want the exercises to be accessory exercises rather than kind of big compound movements. Ben, I might throw this to you, mate. How do you, in your previous experience, how have you optimized engagement with your athletes?
Yeah, very similar principles to what you've already mentioned, I think, Shane. Yeah, it just in terms of habit formation, get it in with a pre-existing routine. I think it just makes it automatic. Let's be realistic. Some days they're going to feel motivated to do it. Other days athletes might feel less motivated to do it. But if it's part of the routine, get it into the schedule, get them used to doing it, it becomes something that we just do to prep ourselves to train. I think it's just a no-brainer not to go down that route with it. And particularly it can be before and after, as you've mentioned. I think that's a really important point. If you're looking at mobility or activation, some of the drop and land stuff I think you mentioned as well around knees, ankles, that works perfectly before training, but particularly like calves, hammy strengthening on top of a run, that's something at the Parramatta Eels we do quite a lot of, and players are used to coming in and doing it after training. Sometimes it's a little bit unfamiliar at first, but once you get into the routine, it just becomes normal. So don't be afraid to think about both ends of training there. And particularly really thinking about the start of those sessions, like not giving them stuff that's going to impact their ability to do that session, because you're not going to get great adherence with it with that. But I think my final point on that would just be actually understanding why we're doing it as well. And I think this is what we're trying to do here today, educate and take people on a journey. Because I think if you're going to give people exercises, they've got to really believe in them and know why they're doing them. So have those discussions and make sure we're not giving too much as well. Like a couple of exercises done really, really well and really consistently that hit the mark are way better than too many exercises that are just doing a lot of a little bit and not enough of like the really important stuff.
Yeah, agree, mate. That's a fabulous point. Less is more sometimes. So now we're getting into the nitty gritty prehab for runners. Let me just take this back a bit. Apologies. So there's been a few studies on the most common injuries for running. So the priority order, or the most likely or the highest instance of injury for runners is, dependent on the study that you look at, but the list is pretty similar no matter what piece of research you're looking at. So medial tibial stress syndrome, MTSS, or Shin splints, which I'm sure we're all familiar with, Achilles tendinopathy, Patellar tendinopathy. We move away from the term tendonitis now. We're using either tendinopathy or tendinosis. Plantar fasciitis, or once people used to call heel spurs, Patellarfemoral pain or runner's knee, ankle sprains, ITB friction syndrome, which occurs on the outside of the knee, hamstring strain, more likely to occur for those who run fast than for joggers, and tibial stress fractures. So I'm going to hand over to Ben to talk about each one of these conditions and the prehab exercises that are worthwhile performing for each particular condition. Ben.
Thanks, Shane. Right, MTSS, medial tibial stress syndrome, your shin splints. Right, let's keep this. Of course, there's so many things you can do for all of these injuries. So this is that we'll go through the key, the big rocks, and don't forget the things we discussed earlier as well around, or the big rocks slide that we went through. That absolutely impacts all this stuff we're talking about. But in terms of shin splints, optimizing your ankle range. So that's going to be through calf stretching, trigger ball, foam rolling, really trying to get that ankle feeling free, because that's then going to reduce the stress going through your shin and really allow those muscles to do their job to ensure that you're absorbing those forces, and optimizing calf and tendon strength. So you're working on the range so the muscles can work at their perfect angle, but then also you're making sure they're as strong as possible. So we all know calf strengthening, like your pretty classic calf raises are a great one. And then consider for those, that might be something that if you're a bit prone to shin splints, maybe chucking in some calf strengthening work at the end of your running, if you're feeling good, could be a really nice way to try and prehab and prevent, you developing those shin splints. Achilles tendinopathies, they can be really tricky to manage. Again, optimizing your calf and your tendon strength. So as we did with the shin splints, that calf strengthening work. Sometimes, again, it can be after the running sessions, depending on how much trouble you've had with it in the past. It might be that you need to have certain blocks of time in your week where you are really working hard to try and get your calf strength up. And keeping in mind, if you are someone who is prone to those tendinopathies, that's going to be time really well invested to make sure that you can manage the running that you're doing. Consider also reducing those compressive factors at the insertion. So again, that's going to be through your calf trigger ball work, your foam rolling. We're not really stretching in this case, because if we're stretching that tendon, we're probably more likely just to irritate it. And as you can see on the slide, cause that compression that can sometimes give you that pain associated with Achilles tendinopathy. So just keep that in mind, because you got your shin splints, stretching's good. For Achilles tendinopathies, not so much. We're more going for that trigger ball into the muscle, the foam rolling, but really working hard on our calf strength. And remember as well with tendinopathies, and this applies to patellar tendinopathy as well, good consistent loading on your running or your training is going to be a really key feature. So if we move into patellar tendinopathy, so that's one around the front of your knee, you're optimizing now the quad and your quad strength and that tendon which runs into your knee. So again, that's going to be specific quad strengthening. So if you think about exercises for quads, you've got your lunges, your squats. Like if you're one that goes to a gym, you've got those knee extension machines as well. Really trying to work on your quad strength is going to help make sure that tendon is robust and can manage the running loads you're doing. And again, reducing those compressive forces at where that tendon inserts on your shin. So that's going to, again, be through your foam roller and your trigger ball. As you can see, there's a bit of a pattern here. With tendinopathies, we tend to steer away from doing too much stretching, because sometimes all you're doing is pulling on the tendon where it inserts, and you can get a little bit angry. So think more, if you've got a tendinopathy, think strength, and then think foam roll, trigger ball, try and release some of that tension in the muscle. That can often give you some nice relief from that pain. Just moving on to the next slide now. Wait for it to come up. There we are. So we've got plantar fasciitis. So that's the one just around the heel. That, again, can be a really tricky one to manage. Reduce compressive forces at the insertion. So using so you've got golf ball, trigger ball, going through those muscles at the base of your foot is often a great way to try and reduce some of that that tension on the plantar fascia, which is just at the base of your heel. If it gets really sore, even a frozen drink bottle and then rolling your foot like a foam roller can be a great one if it is a bit sore. Particularly, you'll often be running still during the time when you're managing plantar fasciitis, so that can be a great one for post-run, and one that we use a lot of with the athletes the athletes that I've worked with tend to like that one. Back to like the shin splints, we're now optimizing that ankle range. So this is one where, because of the fasciitis, stretching's okay. So stretching your calf can be a really nice way to try and get more range through your ankle, and that can take some tension off the plantar fascia, because it's that tissues at the bottom of your foot. And also think about reducing the forces on the plantar fascia, again, through our calf strengthening. So I'm starting, as you can see, there's a few injuries common to runners where maybe a bit of extra calf work at the end of our runs could be a really nice way to try and prevent some of these injuries. Keeping in mind those big rocks, that actually just really good consistent loading will keep your calf strength up as well. We've got patellarfemoral pain. So that tends to be more like your runner's knee, which I know comes up quite a bit. Optimize your single leg control, so glute control and strengthening. Single leg control, think about like your single leg squats, single leg balance, even some exercises where you're in a split stance, even like a lunge type position with that leg that's forward, thinking about how's my control? Am I getting my glute working? If you get your glute working, you get really nice control through your hip, and that keeps your knee alignment, and you're less likely to develop that patellarfemoral pain at the front. Optimizing your VMO and quad strength, similar to that patellar tendinopathy that we're trying to think about. How can we strengthen the quads? Because then they can take it. They can almost give you a little bit of space around that kneecap, and that often what it feels like when you've got that patellarfemoral pain is that compression around the kneecap. So you, again, thinking like, how can I try and how can I create space? Well, often it's through that strength work. Reduce lateral forces on the patella, and that's just foam rolling the outside of your thigh, which can sometimes be torturous, but is really beneficial. And even using a trigger ball around like your glute can help try and release those muscles in the outside of your thigh. It can be really sore, but it's absolutely worthwhile, and can actually, for some of these people with patellarfemoral pain, foam rolling through quads and the outside of your quad, which we call your ITB, which some of you might be familiar with, really, really helpful, and sometimes can take the pain away very quickly. And then you got your ankle sprains. So optimize your ankle proprioception, which is just your balance. So that single leg balance, and you can progress that in so many ways. Closing your eyes, head turns, using a ball, catching a ball up against the wall, going onto a more unstable surface. If you're in a gym, or if you've got some equipment like the half Bosu balls, using pillows, there's lots of different options. Challenging balance is a great way, and then you make it a little bit more dynamic with like hopping and landing and trying to stay in a nice balanced position. That's and keeping that up even after you've maybe had an ankle sprain for a long period of time has really good evidence to say that will reduce your risk of having an ankle sprain again significantly. And we've just got one more slide to go, I think, Shane. TB friction syndrome again, so optimize that single leg control. So think about how we can try and activate those glutes through our single leg squats, our split squats, even like our single leg RDL if people are familiar with those, and then reducing those compressive forces. So again, foam rolling through the outside of your quads, really, really, really useful. Hamstring strains, as Shane mentioned, tends to be more for our faster athletes, so shorter distances, but optimizing eccentric hamstring strength. So hopefully people will be familiar with a Nordic exercise where you're on your knees and you're lowering your body down. That's an eccentric exercise. Bridge with sliding the heels out, that's eccentric, so it's lengthening of the muscle. That has a really good protective effect on the hamstrings. And then also thinking about optimizing our biomechanics on the hamstrings. So trunk control, making sure we're doing our core strength. That's, again, core strength's a great one to add into your warm-up, but even after, go for a run, add in some core work at the end. That can be a great injury prevention strategy. As with some glute-specific exercises, even with some bands. I know a lot of people are familiar with like the lateral banded squat walks. Those types of exercises can be really helpful for a lot of these conditions. And then we've got tibial stress fracture. So that's where often our shin splints can progress to something more significant. Again, we're really thinking about how can we take load off that tibia. Well, it's through calf strengthening, but also lower limb strengthening, because that tends to be how they occur, where you're not able to use those muscles as proper shock absorbers, and there's more going through the bone. So that's where it's the strength work for those types of conditions are really important. Lots of information there. Hopefully, I've been able to nail a couple of key points there, and you'll be able to take away and help try and manage some of these injuries.
Thanks, Ben. That's unreal, mate. Thank you for that. And, mate, thanks for joining us tonight on our webinar.
No problem. Thank you very much for having me. Hopefully, there's been some good points for those tuning in. And yeah, as I said, this is an area I feel really passionate about. And I think, as you've alluded to with some of the research, Shane, there's some really, and then from our experience working in sport, there's some really promising evidence to say that actually, if you apply these strategies, you give yourself the best chance of reducing your injury risk and staying out there, keep running and achieving your running goals.
Excellent. Thanks, Ben. And for those of you in the online world, I hope you got something out of today. I appreciate you joining us. We're looking forward to supporting you on your running journey, and we're here when you need. Thanks very much.